Good morning, everyone, and welcome. My name is Tom Burke. I'm the president of St. Francis Hospital, a member of Trinity Health of New England. This morning, we'd like to welcome a number of guests, including Governor Ned Lamont, Senator Blumenthal, Congressman Larson, Hartford Mayor Luke Bronin, Commissioner Michelle Siegel of the Connecticut Department of Consumer Protection, and Department of Mental Health and Addiction Services Commissioner Miriam Delphin-Rittman. We thank you all for your leadership on this important initiative. I especially want to thank my colleagues who are here today, including Dr. Steve Wolf, Chair of the Emergency Department here at St. Francis, who we'll hear from shortly. And I think our pharmacy leader, Tara Falsetti, is here to represent an issue that is near and dear to her heart as well. So thank you both. We were thrilled to be part of today's important announcement, as funding is now being made available from the Center for Medicaid and Medicare Services to give all eligible providers access to the Prescription Monitoring Program Gateway. This program will allow our healthcare providers quicker access to a patient's past prescription information, which gives us another tool to use to combat the opioid crisis. As part of our Trinity Health of New England mission and core values, we pride ourselves on our ability to provide equitable care for all community members. As healthcare providers, the integration of tools such as the PMP Gateway ensures that we are able to care for our patients better by seeing the full picture of their care. It is our responsibility to provide complete patient care and being able to access information that gives providers a full picture of a patient's health. It helps us help our patients, which includes stopping opioid addiction before it starts. We know that face-to-face time with patients is important, and this tool will allow our providers to spend more time with their patients, evaluating their needs and developing important care plans. Unfortunately, we know that the COVID-19 pandemic has greatly impacted the ongoing opioid crisis across the state and the country, making this program more important now than ever. Here at St. Francis, our work to combat the opioid crisis began long before the COVID-19 pandemic. It has continued through it and will go on as long as it is needed. We remain committed to providing care, compassion, and the necessary services for members of our community with substance abuse or opioid use disorders. We continue to push new approaches and methods in order to effectively and efficiently connect them to long-term recovery treatment. Much of that work begins right here in our emergency department. Thank you all for being here. I would now like to welcome Hartford Mayor Luke Bronin. Mayor.
Thanks so much, Dr. Burke. Thank you to the entire team at St. Francis, and most especially, thank you to Governor Lamont and his entire administration, the commissioners that are with us this morning, as well as Senator Blumenthal, Congressman Larson, our entire delegation. This is a federal, state, and private partnership to save lives. And as you just heard, we've talked about a lot of crises this year, but a crisis that this community and communities all across our state and country have faced year after year. It got even worse this year, and that is the opioid epidemic. And it has taken far too many lives right here in the city of Hartford, in surrounding suburbs, in the state as a whole, and in our nation. This is an epidemic that has hit every community. And sometimes in public policy, the things that save lives are the things that may seem a little bit technical or process focused. But the truth is, this integration of information systems, giving providers more information about the patients they're serving, will save lives. And that's why I want to give so much credit to Governor Lamont and his team, and the hospital here, and all of the healthcare partners, and also the federal government, for recognizing the need to invest in something like this, even at this moment, especially at this moment, when so much of our focus has been responding to the pandemic. We have to also address those underlying crises that in many cases have been made worse by this pandemic. And I also just want to say more generally, Governor Lamont, one of the things about you and your team that I really admire is that you're not always or only looking for those public policy answers that seem flashy. a lot of the work that you're doing, whether it's from IT upgrades, upgrades to infrastructure, upgrades to processes, or something like this, which is about that information system that connects providers. That stuff makes a lasting difference, and I admire the way that you and your team have focused on it, and I'm grateful for this partnership, which I believe will save lives here in this community. So it's with great pleasure that I turn this over now to one of your great commissioners, Commissioner of the Department of Consumer Protection, Commissioner Siegel.
Good morning, I'm Michelle Siegel, Commissioner for the Connecticut Department of Consumer Protection. I want to thank St. Francis Hospital for hosting this event, the Centers for Medicare and Medicaid Services for the funding that's really brought us all here and to enable the services we're here to talk about. Governor Lamont, Senator Blumenthal, Mayor Bronin, Congressman Larson, and all our other state and private and public interest partners and guests that are all here to help us combat the opioid crisis, and of course all of you for being here to draw attention to this important event. And I definitely want to mention our drug control division led by our director, Rod Marriott, who's really working every single day to expand and support programs that can help protect public health, one of which is the prescription monitoring program. And what the prescription monitoring program does is it allows doctors, nurses, pharmacists to all look up a patient's prescription history. And it's a really valuable tool for our healthcare workers. It allows them to understand the full nature of their patient's prescription drug use. They can recognize dangerous drug interactions, possible drug misuse, or patients who are at risk of abusing opioids. So we're pleased to have received over $1 million of funding that's going to help provide free access to the prescription monitoring gateway for all of our prescribers and pharmacists, and it allows the integration of healthcare records in the prescription monitoring program. This is going to make it faster, easier, just a much better way for now all of our healthcare providers to support their patients and really be spending time with those patients and helping them with their issues rather than dealing with kind of different logins and different computer programs. So thank you again for being here, and thank you to all our public, private, federal, state partners. With that, I'd like to hand it over to Dr. Wolf.
Good morning. Thank you, Governor Lamont, Senators Blumenthal, Congressman Larson, Mayor Bronin, Commissioners Siegel and Delphin Rittman for joining us today and for providing us with this advancement. Additionally, thank you, Commissioner Delphin Rittman, who has supported our ER Suboxone program since 2017, and Rod Marriott, head of the Drug Control Division, who has been very supportive over the years and a pleasure to work with. The PMP Gateway has been a valuable tool for those of us on the front lines trying to contain the opioid epidemic. While we are dedicated to alleviating pain, recent years have demonstrated that the need to be much more aware of the addictive qualities of these medications, making the PMP a vital gateway part of the appropriate treatment. This direct connection to the database, funded by the Centers for Medicare and Medicaid Services, allows providers and others to directly query the PMP gateway from the patient's open medical record, negating the need to log into a separate system and find the patient using birth dates and other information. Not only does this save a great deal of time, especially in a busy ER, but it will vastly improve compliance in checking the system and the ability to avoid administration or prescription of controlled drugs, substances, to patients who have substance use disorders or other issues. We are grateful to our state leaders for recognizing the need to continue this work and do our due diligence to ensure those with substance use disorders are provided the optimal care they deserve. Thank you all once again for being at the forefront of treatment and prevention of substance use disorders. Thank you very much, and I'd like now to introduce Senator Blumenthal.
Thanks, Dr. Wolf. Thank you, Dr. Wolf. Thank you to St. Vincent's for the great work that you do, and thanks to all the heroes, the frontline workers, all of you who are here, the great healthcare providers, docs, nurses, administrative staff. We can't thank you enough for what you've done. this PMP program has actually been around for a couple of decades. I remember well when it started because I advocated it in response to a very simple, ugly problem. Doctor shopping. Addicts, doctor shop. This money will help fund a program that ensures that addicts don't doctor shop, don't disappear, don't use different sources of prescription drugs to fund their substance abuse disorder. I began advocating for this program as Attorney General of the state because of that law enforcement problem. And the federal government funded it for a couple of years, and then, as the federal government is wont to do, it said, okay, now states, you're on your own. And we then funded it in the state with money from Purdue Pharma, money that we got by suing Purdue Pharma, and that was the first lawsuit against Purdue Pharma that produced money for the state of Connecticut. The state of Connecticut then stepped up. This was bipartisan, by the way, and funded the program. Now we have, and here's the important part of it, a reliable, constant source of federal funding to stop doctor shopping, assure treatment for the people who need it, because they need treatment, they should get it, and assure that taxpayer money is well spent. And the PMP program should have been around a lot earlier. In fact, it took effort then to link our PMP program with other states, because people who have substance abuse disorders will cross state lines. And then finally to link it with the VA. And it is now linked to other states and the VA because of those efforts. I want to credit Governor Lamont for taking the next step, accepting this funding. I want to say how grateful I am to have worked in partnership with my great friend and colleague, Congressman Larson, who has been a champion of the Centers for Medicaid and Medicare, and I'm very proud to introduce him now.
Well, probably should take this off. Thank you, Senator, and let me echo the sentiments of Mayor Bronin and Senator Blumenthal, especially as it relates to the hands-on work that goes on every single day by the true heroes and heroines of this pandemic, the people on the front lines in our hospitals, our providers. You've been outstanding, and that takes leadership and vision. It also takes a governor who's a hands-on governor as well. I think Luke said it well with respect to your team, Governor, and we're going to be hearing from commissioners as well. But COVID has turned the whole country upside down, and it is a major pandemic. But it has also exposed the underbelly of an existing crisis and the need for us to continue to collaborate and work together. Senator Blumenthal outlined how that works between the federal government and state, but you have to have a team in place, and you have to have a group of dedicated officials, and Governor Lamont and his team have done just an outstanding job. And anytime you get to be at an event where you're talking about $1.3 million coming in directly to aid the state in this effort, and the new technology, well, as it's been said, the technology's been around for a while, but to be able to have the tracking and the tracing, and to make sure that, as the Senator said, we're not able to doctor shop, or pharmacy shop for that matter as well, And to have this technology at our disposal and to be able as an entire delegation to work to make sure that those benefits are here, and then to see a very coordinated effort that the governor and his team and St. Francis and theirs and the entire community pulling together, well, that's what it's all about. So it's now my high honor to turn the mic over to Commissioner Weldon.
Thank you. Thank you, Senator Larson. And good morning, everyone. And thank you to Governor Lamont, Commissioner Segal, President Burke, Dr. Wolf, Mayor Bronin, Senator Blumenthal, and all of our partners here today. It's a pleasure to be here for this really important announcement. We know that we need every tool and every resource available to fight this opioid crisis, which unfortunately we've seen get worse as we've been dealing with COVID as well. The PMP has become a critical prevention tool to help stop addiction before it starts, and this integration will allow our providers to expedite this process. The use of technology such as electronic data collection, real-time monitoring, trend analysis to help identify and respond to the opioid crisis has proven to be an important tool. The prescription monitoring program are electronic databases that help prescribers and others by giving real-time information to quickly identify possible drug-seeking behavior and inappropriate shopping. Presently, most providers have to go through several steps to find a patient in the system, which is a considerably time-consuming process. Now, with a direct connection to the electronic medical record, this expedites that process of finding a patient's information and allowing providers to check patients' records in the PMP before prescribing opioids and other controlled substances. The gateway also includes access to the NARCS care, which provides the ability to identify and manage patient prescription drug risk analysis real-time. So real-time risk analysis, another tool to ensure that practitioners are seeing the most complete picture of a person's health. We are so grateful for these funds and for the advocacy that helped bring these funds to the state. This type of collaboration across multiple agencies and our community providers is just what we need and what we've continued to do in Connecticut to help address this crisis. Thank you. And now I have the great pleasure of introducing Governor Lamont. Governor.
Hey, thank you, Miriam. Good morning. And Tom and Steve and all the folks at St. Francis, thank you for what you've been doing. I know it's been a heck of a year, and we couldn't have done it without you. You've been amazing partners as we've gone through this really rugged journey. And you know, why are we here? I think Mayor Bronin said it well. Sometimes little things can make a big difference. And this $1.3 million grant, look, I've been working hard, as was said. You know, we got to bring our state government in terms of IT up to the 20th century, 21st century. I mean, look what happened in the Department of Labor. We've been putting these things off for a while. What a difference it made. Josh Jabal is trying to do that across all of our departments. Who would have thought that mental health and DOC, consumer protection, all got to be able to talk to each other, and that's what we're doing. And what this grant means is that we're bringing IT up to where we ought to be, and we're able to share information. And I heard a lot about, you know, opioids and opioid shopping, as Dick and John said, and going from doctor to doctor. No longer will they ever be able to, that doctor be able to say, I didn't know. I didn't know they had already gotten the prescription. Now there's no excuse. Now we know. Now this is just one more step we can do to help our state get on the mend and our country get on the mend by being extraordinarily careful and making a difference when it comes to opioids. And we're making a difference with the vaccines. Again, I got to thank each and every one of you. You know, it's been a little choppy. You know, our trends have been edging up here in the Northeast region. I think you know that. I was getting a little edgy myself, but really happy to see that our infection rate is back down below 4%. I'm really happy to see that our hospitalizations are down a little bit. And I'm really happy to see that our fatalities yesterday were one. That's one too many,
but that's the least we've had in 4, 5, 6 months. And that's because the vaccinations are working. And it's just ironic to me that today, over in the legislature, there's a big, loud debate and vote on whether we make it easier for people to not get vaccinated. Here at a time when we realize that vaccinations are saving lives. And as everybody says, we're not out of the woods yet, but nor are we lost. I think we know where we're going. I think we know what we got to do. If we hang together for a few more months, I think we're going to really find that the bulk of us have gotten vaccinated and we're getting back to a new normal. And we couldn't have done it with the amazing healthcare professionals I have an opportunity to stand right next to. Thanks, everybody.
Thank you, everyone. That concludes the official program. We're happy to take just a few brief questions, though. Thank you.
When will this be available? You got the $1.3 million. When is this going to be up and running?
You want to take that? Joe, you got that?
Hi, I'm Rod Marriott. I'm the director of the Drug Control Division for the state of Connecticut. Yeah, could you repeat the question for me because I was unable to hear?
Sure. We're announcing the $1.2 million funding. When is this going to be up and running? When are doctors going to be able to look up this information?
So they're already able to look up the information. The funding will allow for this connection for those that are already connected, which is approximately 75% of our healthcare professionals. We will be kind of crediting their account for that purpose. For those that have not connected, they can start that process right away. Our website has a link where they can connect with our vendor to commence that connection.
Well, we were told that they have to go into a separate system to look this information up. That's what I'm wondering, when is this seamless capability going to be operational?
So the seamless capability is available now. If an institution hasn't already started that process, they can do so by commencing that web form on our website. But as of today, 75% of our healthcare practitioners are already in that direct connection portal. Yes, you are correct about the statutes. They are looking it up. There's just two different mechanisms to look it up. We have a web-based portal where you can log in using your own username and credentials, and we have this direct connection which integrates with the electronic health record to allow practitioners to look it up more seamlessly without having to leave their record to go look up that patient. It leverages their already used sign-on at the electronic health record level.
Mr. Marriott is probably more knowledgeable about the exact fine points of the law, but I personally require my staff to check it on everybody. There's not that requirement on every patient. There depends on the amounts that are prescribed, but for safety's sake, I encourage my providers to check on everyone, whether they write a prescription or whether they're administering within the ER, which is not a requirement. So, if I'm correct. But the direct connection will make it so much easier for the providers as they're running around to just have one click as they're looking at the patient's record instead of logging in, putting in patient birth date, name, and struggling with that. The system is a good system, but it still takes time. So with this direct connection makes a huge difference in compliance. People will be checking it much more easily and readily. So
you are correct. You are absolutely correct. There is a duty right now. This is really important to understand. the providers, doctors, pharmacists, have a duty right now to check. It's no defense morally or legally for doctors to say, oh, well, it was hard to look it up. This will make it much more readily available. But make no mistake that doctors have an obligation to check whether they are prescribing to the same patient for an opioid that's already been prescribed by another doctor. That's what we mean by doctor shopping. When somebody suffering from substance abuse disorder goes from one doctor to another, fulfilling, in essence, the same need, and thereby is able to perpetuate a substance abuse disorder rather than receive treatment, that's bad for everyone. And in fairness to that patient, the doctor has an obligation to make sure that he or she seeks treatment. And I might just add, 1.3 million seems like a small amount, especially when the president's announcing today a $2.2 trillion infrastructure program. Part of it will go toward the infrastructure necessary in our medical care system, but this money is going to make a big difference, and fortunately Governor Lamont is using it in the right way.
Following up on that, Senator, can you talk more about the infrastructure plan and the impact that's going to have on Connecticut and the governor's involvement?
Yeah, I mean, it's hard to exaggerate the effect of this infrastructure program. This announcement of an infrastructure program, this program will turbocharge Connecticut transportation. It will enable reconstruction of our roads, bridges, highways, but also there's $100 billion for broadband. There is money for our schools, for all kinds of other public facilities, but most important, this program is going to mean thousands of jobs, good paying jobs here in Connecticut. $2.2 trillion will be going into the roads and bridges of Connecticut that will make our lives safer. $80 billion into Amtrak that will enable much more reliable and quicker transportation. Again, jobs, jobs, jobs. And it will be funded by increases in taxes on corporations, not individuals, and elimination of tax loopholes that encourage or reward businesses for moving jobs and profits overseas. There is a very strong green economy component here. Electric automobiles will be receiving hundreds of billions of dollars. It funds a green economy. It funds racial equity. It is about jobs, making our roads and bridges safer, enabling more railroad transportation more reliably and safely. It will revolutionize transportation, and it will create thousands of new jobs in Connecticut. So it's historic, momentous, and I'm going to strongly support it. I know we're going to have a tough fight, but we're ready for that fight because it is great for Connecticut and for the country.
Yeah, I would concur. I would concur with everything Senator Blumenthal said, but here we are in Hartford, Connecticut. The number one chokehold in our highway transportation system is the 8491 access. The two levees that protect East Hartford and Hartford are going through sandpiping and in desperate need of urgent care as well. This is the kind of proposal by the president that is going to be made first today at 4 o'clock official, but then again later in May because of the tranches of money that are going to be continued to be needed in order for us to invest in this infrastructure, not only, as Senator Blumenthal has indicated, in highways and roads and bridges and trains and planes and automobile, but also human infrastructure that is going to be vitally important as well in terms of turning this economy back around and getting at the long neglected areas that need to be addressed. It's been a real pleasure again to work with the governor and the Commissioner of Transportation here as well, who have gone out already, gotten ahead of the curve and looking at how we move ahead with design and build and what this region really truly needs to do. And Mayor Bronin presented yesterday with a group of us, including Hartford 400, about North Atlantic Rail and connecting us by rail to our airports and to the great cities of Boston and New York. And Hartford in this region and the state of Connecticut is going to become an integral hub in all of that. But it's going to take the federal government, whose primary responsibility it is, to step up and get the funding. Dick's right, it's going to be a tough fight. But infrastructure, as we like to note, is neither Democrat, Republican, red or blue or green. It's what the country needs. And I think we have a great opportunity here for the nation.
Well, first of all, on the Pfizer announcement, I hadn't heard that. Right now, Pfizer is good for 16 and above. Everybody else is at 18 and above. And you just said it's now 12? Okay. Look, we're going to have the vaccines available for all ages, I think, by the end of this summer. Pfizer's on the cutting edge here. Connecticut's very own Pfizer, I might add. And we're going to be rolling out a process where those younger people have an opportunity to get vaccinated. Obviously, the people who are now suffering the ill effects of COVID are less than 45. They're younger people, and mainly teenagers, 20s and 30s, sometimes coming back from Miami Beach. So we want to get those people vaccinated. So I think that's really good news. And I thought the UConn women were just amazing, standing up to Baylor. Baylor was big. Oh man, they were big. And I love what they were able to do, and no dispute, they're the world champions. You watch.
Should have equal training facilities, amenities, accommodations.
Governor, did you reference the ongoing discussion at the Public Health Committee? Could you please reiterate your position today on religious exemption for required school vaccination?
Yeah, as you know, right now we do have required school vaccinations. It's keeping our schools safe. I'd have a harder time getting kids into school if they thought that they were not being safe. There are two big exemptions. One is a medical exemption, something that I think the doctors here know that those kids at immunological risk, they ought to be exempt. And the religious exemption, where we got to be a lot more careful about that, because that's being, perhaps expanded every day. So I think the legislature is doing the right thing by trying to close that and make sure that if people need a medical exemption, they got it. And someday we'll be figuring what we want to do with the COVID vaccine as well, because it's keeping people safe. And we made it this fall to convince people how safe it is to get back to school.
So you're talking about possibly requiring children to be vaccinated against COVID?
I think that's premature. Right now what we're doing is encouraging everybody to get vaccinated.
Governor, the VAM site right now says people 16 plus are aware of that. Is that any sort of change in policy? Are any adults 16 plus able to sign up for a vaccine right now?
No, they got to wait till 12:01 tomorrow morning, and I think a lot of them will be there hitting refresh. If VAM says, I think they're anticipating the future if they've already got it on the site.
Governor, you talked about the trends. Yesterday, the CDC released those numbers saying Connecticut was fourth in the nation in terms of infections per 100,000 residents. You talked about yesterday how this kind of has to do with testing a bit. Can you kind of elaborate on that?
Yeah, I don't want to beg off on it. Let's face it, the Northeast region has a higher infection rate, especially New York, New Jersey, and we've seen that movie before. There's also no question that Connecticut does, 5 to 10 times more testing per capita than many of these other states. That artificially inflates the number per 100,000. But I'm not diminishing what we got to do to get through this over the course of the next couple of months. nor do I want people to panic. I mean, you know, the numbers were creeping up. Now they've stabilized. We had the same infection rate, about 3.7, I think it is, over the last 2 weeks. So there's good capacity here at St. Francis. There's good capacity at all of our hospitals. This is not like last April, not to mention December.
And these new infections, they're younger people, right? Because it's sort of those cases drop among the older people that have been vaccinated.
Yeah, I mean, you could probably speak to this better than I can, but it's remarkable to me that we have, over 35% of our people have the first vaccine. A lot of others have a natural antibody because they've already been infected. Maybe we're getting close to 50%, and yet we still have a relatively high infection rate. It reminds you that this UK variant is very, very infectious. You want to add to that?
Yeah, no, I think the governor said it well. I mean, really, those at risk are the younger people now. They're exhibiting risky behavior, getting together in large parties, and we're seeing the effects of, I think, spring break and parties all over the place. So, I mean, vigilance still has to occur. I can't understand the governors in Texas and Florida where they're saying forget the masks, and I mean, Texas is suing one of their major cities because they want to enforce masking. It just makes no sense with all the medical knowledge that we've had. Some states insist on making the same mistake over and over again and risking their population. So it's we still have a few more months at least to go to be careful. People need to get vaccinated, continue wearing the masks, and continue being smart. And right now, not everybody is. So we've got to buckle down still.
Yeah. Okay. Thanks, everybody.
That concludes our event. Thank you.
Take care. Good to see you.